Hi, thank you for having me. I'm Olazagasti. I'm a thoracic and head and neck oncologist at the University of Miami, and I'm very happy to be here joined by my colleague and friend.
Hi, everyone. My name is Maria Velez. I'm also a head and neck and thoracic oncologist at the University of California, Los Angeles. And I'm excited to be here to talk about what we're excited about during this ASCO 2025.
Yes, I think like whenever it's like time approaching to ASCO, everyone gets so excited. We talk about our outfits, our nails, and then the science that we're going to be looking forward to because it's kind of like a special occasion because we get to just learn the science and see our friends and like just collaborate, gossip, chat, talk, and like meet new people and network. And it's such like an amazing opportunity. So I don't know, what are some of the things that you're most looking forward to this year's at ASCO?
Yeah. So I think, yes, as you mentioned, definitely seeing my friends, my colleagues, networking, and of course, seeing the exciting new data that's being presented. So, in the lung cancer space, there's a lot of data already in the neoadjuvant and adjuvant and the perioperative space using immunotherapy. For someone, like us who does also head and neck, it's very exciting to see some of these approaches being applied in the head and neck space because there's it's such an unmet need. Those patients really there's not a lot of targeted therapies in that space, and so seeing the use of immunotherapy with radiation or adjuvant radiation and perioperative, which was presented, I think, a few months ago or a few weeks ago at AACR, it's very exciting. How about you? Is there anything that you're looking forward to seeing?
So I'm excited to see the data. I'm excited to see the oral presentations for all the abstracts for thoracic oncology. I know that we're going to get some updates of like PFS and survival. We're going to see some like neoadjuvant studies with TKIs, and then we're going to see just like so much what's in the future, what's in the pipeline. I mean, besides the data, I'm excited to see not only like our friends and our sisterhood, but something that's very special to me is also to see my mentees and seeing just them present and see how their work is flourishing and seeing just how great they are. It just makes me such as a proud mentor. For example, one of our fellows this morning was talking about the impact of like alcohol and different types of cancer, and having the younger generation up in the podium is something that I feel so proud of, and it feels like like very exciting to see. And like we talk about like our sisterhood, I think being in oncology is being sometimes very challenging. It can be emotionally taxing. It can be very lonely, and then you can at times feel like a little bit lost. So it's always good to have people like having your back, knowing that we're here for you. Let's do studies together. Let's collaborate. And if there's really something that we feel like we have to address because of how we're feeling in the field, then let's just make a study about it. And that's really how our most passionate projects really are born from. So just so much to be excited about.
Absolutely. Yeah, I agree. I mean, I think, being in oncology, being a Latina, being able to have this platform to get together and discuss, potential collaborations is fabulous. I think, we met each other through the Flores Lab and collaborations together, and we've become not only colleagues but really good friends.
Yeah.
And so one of the things that I look forward to every year is being able to see my friends that live in other parts of the country, and also discuss what we were talking about earlier today, how we approach the patients that we treat in a different way because we're at different institutions.
Right.
You being at University of Miami, me being at UCLA, we see different patient populations with the same diseases. And so it's interesting to see your approach versus the approach that maybe we use at UCLA. And for instance, I think this morning we were talking about EGFR mutant metastatic cancer and what you use as first line, and how you have that discussion with your patients versus what we do in California.
Yeah, it's kind of like a collaboration corner. It's like a discussion corner. We share like stories. We share patient cases. Like, what would you do in this setting? And it's just something that's like really remarkable to kind of like have someone to back you there. And like we were even talking on our way over, it's not only about the collaborations, but also like sponsoring each other, right? Like we're minorities, we're obviously junior attendings, and we really want to make our mark in the oncology world. And so what a better place to, if there's opportunities to, sponsor each other, to be like, okay, I have this opportunity, I have the perfect person in each other, just to make sure that, we're giving a seat at the table, because I feel like we deserve to have one. And just bringing people over and having a space for each one of us, I think it's very special.